We'll now turn to Brian Gottschall, our Director of the Berks County Department of Emergency Services and our lead on the Berks County COVID-19 leadership team for the Berks County COVID-19 data report. Brian Gottschall.
Good morning, Commissioners. Yes, December 16th, very quickly, I'd like to mention in the spirit of our discussions about our partnership with Muhlenberg Township that they and their personnel were instrumental in helping us to get the Berks Cares vaccine clinic open in Muhlenberg Township at the Walmart Plaza in the spring and early summer of this year. So that's just yet another example of great partnership between the county and Muhlenberg Township. First slide we want to take a look at is our cases and testing. We continue to see enormous growth in the community of COVID cases. The blue line on the right side of the graph demonstrating that over the last 14-day period, we have far exceeded all prior 14-day rolling totals for new cases in Berks County. Oops, sorry about that. Also want to take a look at our nationwide outlook that we've been seeing for the last few weeks here. Again, focusing on the part that's circled in red. We see there's been about a 1% change both up and down in counties in the United States, but generally the conditions are pretty much the same. The vast majority of the country is in high spread. One thing worthy of note, I focused in on Maryland and wondered what the heck they're doing so close to us and how they have so much low and moderate spread. And that's actually an anomaly that has to do with the fact that they're not reporting their case counts in the same way that most other states are. They're basing their numbers only on test positivity, not on actual community transmission. So that does represent a pretty big anomaly, very much close to home, and I wanted to draw some attention to that. Our pediatric cases in Berks County continue on an upswing. As I've mentioned before, our 5 to 18-year-old cases have gone up and down over the last number of weeks, but we did see a pretty dramatic increase this week. Likewise, our 0 to 4 cases are continuing to rise slowly on a week-to-week basis. One thing I do want to note is while those numbers are up, they're up in proportion to the total community numbers. So I don't think it would be fair to look at this slide in a vacuum and say there's some new significant impact on kids. It's very much a product of the fact that cases are up in general. Our hospitals actually look a little bit better this week than they did last week. Again, I don't think it's representative of any easing or alleviation of the strain, but anytime we see good news, I think we want to emphasize it. And this week certainly did look slightly better than last week across the board in all categories for census, ICU, and ventilators. Again, back to the bad news side of things, our influenza numbers continue to rise. We had yet another week of rising cases. Keep emphasizing to folks that we have an opportunity for an exit ramp in these numbers. Folks can get their flu shot, can take appropriate precautions, not go out and about when they're sick. Of course, do very much the same kind of things we're asking them to do with respect to COVID to protect the community from the double tap impact of COVID and influenza at the same time. Very quickly, in our current events and things on the horizon, we, of course, began talking about Omicron last week. It really broke in the news the week prior when there was not a meeting to talk about it at. I think our wrap-up for this week will be simply to say that there's still a lot of data coming out. We continue to see both laboratory and real-world data indicating that the virus is certainly more transmissible. Some numbers that have been thrown around are 70% faster replication in the bronchus of the respiratory systems. But the good news piece of this is, while there's certainly not a final answer here, a lot of the data is continuing to firm up, saying that the disease is not more virulent. So more likely or more easy to contract, but not necessarily more capable of causing severe disease or hospitalizing us or killing us in a way different than what we were dealing with Delta. Also, it bears mention that it appears that the more current vaccine you have, the more neutralizing antibodies you have, and the more protective it is against that Omicron variant. So again, kind of a cheer for booster shots that are more current than our older vaccines might have been a number of months ago. Reminding everyone that we do have a public COVID testing site outside of our offices at 2561 Burnville Road. That testing site will continue to operate as is on the slide and as we've talked about previously, but I'm also able to now announce that we're going to extend that testing site yet another week through the week of December 27th to the 29th, where it will operate on Monday through Wednesday, shutting down, not operating Thursday, Friday, Saturday due to the Christmas holiday, but open from 10 a.m. to 7 p.m. at no cost for anyone that is interested in pursuing a COVID test. Just again, the slide that we've been showing you the best way to access that site, Burnville Road or 183, however you call it, to the red light at Van Reed Road, and then the side entrance of the Direct Link facility where our offices are located. And then finally, our weekly promotion of the doyourpartberks.com webpage, where we would encourage folks in Berks County to go and find out any information they're interested in about COVID vaccine testing, anything really related to the COVID virus and response. And with that, Commissioner, I'm back to you.
Thank you very much, Brian. Any questions or comments for Brian? Hearing none, we will move on with our agenda.